Told you we needed to cut your head open. How did you feel?
How would I be afterwards? How would the scar look? What condition would I be physically? Would I be able to do my everyday activities, function on a cognitive level?
Hello, this is Dr. Lee. I'm excited to introduce you to a new series that I'm calling Profiles in Courage. It's reminiscent of John F. Kennedy's book, where he describes senators who made decisions that were politically courageous. However, what I'm interested in and what I'm excited to share are the stories of my patients who allowed me to cut open their brain, to go inside into the most delicate, the most dangerous, the most beautiful parts of their soul, and then emerge and conquer. During the pandemic of 2020, we talked about healthcare heroes, but I also believe that there are heroes amongst our patients, and these are their stories. Hi, Dr. Lee here. I'm here with on the solar eclipse day. Here with it has some meaning. Here with she has a very unique story. We just did brain surgery on her about how many weeks ago? 4 weeks ago.
4 weeks.
Okay, and she's doing great, but it's let her tell in her own words how this was discovered.
Yes. So, hello out there. We did an MRI, and we watched the tumor for maybe like 3 months, and it got larger.
One very common question on the internet always is, how do I know I have a brain tumor? And in your case, you didn't really have that many symptoms, right?
No, I didn't. I didn't have any symptoms at all. Well, I felt like I was dizzy, basically. That was it. I had my normal everyday life. I didn't have any headaches, and no, really no symptoms at all except that.
Yeah, so that's a scary thing, but Tamika has a different condition which predisposes her to having tumors. So not everybody has this condition, obviously. But then when I told you we needed to cut your head open, how did you feel?
Oh my goodness, so many emotions. I felt a little nervous to say the least. I wondered how would I be afterwards? I wondered how would the scar look? I wondered what condition would I be physically? Would I be able to do my everyday activities, function on a cognitive level? Yeah, I had so many emotions going through. Yeah.
Yeah, it's when we think about brain surgery, it's one of the scariest things because it's your human being, it's you're who you are, and how you think, how you speak, how you act. In this case, you get to see a beautiful demonstration of a technique that we call tumor glow. That was developed here at the University of Pennsylvania, where we administer a near-infrared dye, which then allows the tumor to glow and provides amazing contrast and visualization. We're able to localize the tumor instantly. It's a wonderful technique that we employ here. So this is what we see with our eyes. But then once I turn on the laser and excite the fluorophore, you can see the position of ICG in the middle of the tumor, and that is green pseudocolor overlay, red yellow heat map overlay. This is an exciting technology, and you can clearly see it with your eyes, and I was able to show this to the patient herself, which is really remarkable. And do you feel that there's been any change after the surgery?
For the first 2 weeks, I was just a little tired, but other than that, I feel fine. It was one of the easiest surgeries that I had, actually. Thanks to Dr. Lee, he found it, and I feel fine. Honestly, I feel really good.
That's great, because you do have steps coming up, and you're going to need all the strength and energy in order to get through that. Once that's done, What do you look forward to?
Oh, goodness. I look forward to many things. Going on vacation, to say the least. Just being out and active with my son. He's 8 and he plays hockey, baseball, basketball. So I'm a very busy soccer mom. And just enjoying life, going to parks and my everyday routine. I'm a teacher. And I am looking forward to getting back to work as well.
All right. Well, we're going to root for you.
Yes.
All right. Well, enjoy be careful of the solar eclipse today.
Yes.
All right.
We already have our classes.
Bye-bye.
All right.
Good. These patients are incredible. They have to live with the fear of developing the tumor. Then we have to make a decision to go ahead with the surgery. And it's incredibly mind-numbing. And yet, she's able to proceed and recover and do incredibly well. True profile of courage.